All right, my friends, you're not going to believe this, but just out of the blue, author John Luzonis, who I told you his book is on the recommended reading list, just happened to walk into my office. Today is day number 18, and I want to ask Kid Trillionaire a question. So, if you had to say, what's the one piece of advice? You give a lot of wealth advice here, right? And I told you that I think a lot of the things that you talk about when it comes to wealth also apply to health. So what maybe are like the 3 things you would recommend to people in terms of taking care of themselves and taking care of their health?
Well, sure. Number 1 would be to start early. You should be focusing on your body as soon as you realize that you need to do that. You know, you shouldn't be like, oh, I'll go on a diet tomorrow. That's what they all say, and then they never go on a diet. Number 2 is you should study healthy people. Somebody you know who's really got those big muscles, ask them what they do to work out. And number 3 is you should set goals for your body. Just how some people set goals for their finances, you should set goals for your body, as that will help you get a clear idea in your mind of what you can do to improve your health.
Great advice. So I told you guys that we're going to have a webinar with John, because how old are you?
13.
He's 13 years old. You had a bar mitzvah or no?
No.
No bar mitzvahs for him. That's okay. It's all right. But we're going to bring this 13-year-old on because I'm going to tell you something. When you read his book, it's a great read. It's an easy read, okay? It's an easy read because he's a good writer, not because it's not smart stuff. But as I was reading it on the plane, I'm telling you, everything he's saying about wealth, I was saying I should say these exact same thing to my people about health. Any last words for the Pulmonary Wellness Online?
Yes, Dr. Greenspan knows what he's doing.
My man, thank you very much. That's alrighty, everybody. Today is the day 18. Today is day 18. You are now almost adults of Pulmonary Wellness Online, and it is time for the question of the day. This question of the day came to me during one of my live presentations last night, my pre-Halloween go live. And the question, it's a great question. It's a great question. And the question is, do our meds make a difference in longevity of life or progression of the disease? Or progression of the disease. Okay. Do our meds make a difference in longevity of life or progression of the disease? And the answer to this question is maybe. We don't really know, okay? And certainly while we have some ideas on a global level, okay, or more on like a public health level, as an individual, it's hard to, you know, a lot of times people want to put things in nice, neat boxes. They want to tie them up with a nice little ribbon and make a bow that everything fits perfectly into this box exactly the way it should be. And the fact is that life, as I say about breathing all the time, if you watch my stuff, you know that I say that breathing is multifactorial, right? Nothing is simple. Very few things are simple in life. And so to answer a question like, do our medications, will they change the progression of the disease? Will they prolong life? Will they make me feel better? What will they do? I know a lot of times people take medications and it's sometimes difficult to tell, is this doing anything for me or not? Sometimes I feel it, sometimes I don't. I started taking this medication, I don't feel anything different at all. So let's talk about some of the medications. So when it comes to pulmonary fibrosis, okay, up until very recently, there were no medications at all. Now there are medications. Now there's Ofev and Esbriet, okay? And what these are supposed to do is they're supposed to stop the proliferation of scar tissue. So in other words, they're supposed to slow down or arrest the production of more and more scar tissue. So the idea is, if you jump on this early, okay, if somehow we can raise the awareness of diagnosis for interstitial lung diseases as a whole, but in particular IPF, because the lifespan is said to be so short, and can put a halt on it before your body has had a chance to lay down all that scar tissue, then I would say absolutely affects progression of disease and absolutely can affect longevity. Okay, when we talk about the the pulmonary hypertension medications, okay? If we can ease the pulmonary hypertension, then certainly we can ease many of the symptoms, and not just symptoms, but body adaptations to long-term pulmonary hypertension. So I would say change progression of disease, change lifespan, okay? And then when it comes to COPD, it's a little bit different, okay? And the reason why I say it's a little bit different is because a lot of the COPD medications, the bronchodilators, the anti-inflammatories, as opposed to really, let's say, changing the progression of disease, like whereas the OFEV and Esbriet will change, hopefully, the progression of the scar tissue being laid down, and the pulmonary hypertension meds will open things up so that we, there's less secondary effects, and so that the pulmonary hypertension eases the burden on the heart and reduces the incidence of heart failure, et cetera, et cetera. The, the COPD medications are often symptom treatments, okay? So they're bronchodilators to open the airways. They're certainly anti-inflammatories to reduce inflammation, okay? But again, I give you the same answer for all three. We don't really know, but let me plant some food for thought in your brain, okay? Because the way that I see a lot of the medications, particularly the inhaled medications, is similarly to the way that I see oxygen, okay? Of course, some people need them, and without them, they're gonna have a really, really hard time. But I view the medications and I view the oxygen as a bridge, okay? Almost like a crutch. But a lot of times people use the word crutch as a negative, right? I view it as a crutch or a brace or a support or an ally or a buddy or a sponsor or whatever it is that you want to consider it. But I believe that taking the medications properly may have an impact on the disease, right? But it may not, but it still may be able to improve your life significantly through the addition and through lifestyle change. So through the addition of healthy habits, through the removal of unhealthy habits, and through overall lifestyle change. So when I say that breathing is multifactorial, I talk a lot about the fact how I can see somebody a year later and their pulmonary function test is identical to 1 year ago. Yet the patient is either much less short of breath or much more short of breath. So if somebody comes in and they're much more short of breath and their pulmonary function is exactly the same, well, that tells you right there that there have to be other factors, extra respiratory factors, meaning outside of the respiratory system, outside of lung function alone, that contribute to how well or how poorly we breathe. And very often it's that, hey, I gained 25 pounds. Or you know what, I used to go to the gym every day and now I don't. Or you know what, I used to take the subway to work, but I couldn't do the 4 flights of stairs every day, so now I take the bus, right? So the idea is that if you think that taking 20 less flights of stairs per week is not going to have an impact on your health and well-being, and then, these things snowball in the same way that things snowball downhill, they can snowball uphill. So if you're less active, if you've gained too much weight, if you've lost too much weight, if you're eating unhealthy foods, if you're stressed out of your mind, if your immune system is weak, et cetera, et cetera, et cetera, all of these things contribute to an overall negative result. As opposed to if you're at the right weight, if you're exercising on a regular basis, if you're doing things to manage your stress, anxiety, and depression, all these things snowball to improve your wealth, your health. I said wealth because of John Luganis. But here's the thing. Does it really matter what it is or what it isn't? What's the cause? So if I say to you, you're going to do these things, you're going to take the medication, and the medication is going to improve your health, your well-being, and your lifespan, or you're going to take the medication and the medication is going to allow you to do the things that are going to do that, it's a bridge to the positive behaviors. And one of the things that I'll caution you against is that sometimes, and healthcare professionals are guilty of this too, is you will report shortness of breath, and so your doctor may give you more medications or different medications, or you may desaturate and now you're getting oxygen. Don't expect the medicine alone to get you up that flight of stairs without shortness of breath. Don't expect the oxygen alone to get you up that flight of stairs. Don't expect the medicine or the oxygen to get you to be able to walk up that hill. No. As I say over and over again, your body gets good at doing what you ask it to do. So if you ask it to walk up 4 flights of stairs per day, eventually it's going to get good at that. If you ask it to walk up a big hill every day, eventually it's going to get good at that. If you ask it to do nothing, if you ask it to sit on the couch and flip the remote as you watch Dexter, not good, okay? So I love that question. It's a real philosophical question. And it's a question that's going to be different for every person. So we don't know exactly what it is. There's no way to know exactly what is doing what. But small changes in multiple areas with respect to positive lifestyle change are the ways that you are going to increase your chances of delaying your disease progression, increase your chances of actually improving your lung function, and increase your chances of living longer, in my opinion, increasing longevity, okay? Great question, love it, super philosophical, okay? And I'd love to hear comments on that. Thank you for your question. Have a great day, everybody. Day 18, let's get it. Bye-bye.